Well, let me start by saying I'm honored to be selected as a game changer. I accept it on behalf of our organization because I think we at Florida Blue are trying to make a real difference in our industry. When I look at the things that are going on in the healthcare space, it's really important that people like us at Florida Blue have a voice in what happens to healthcare and health in the country as we move forward. So one of the critical things in my mind, something I've fought for my whole career, is affordable quality health care. There are some parts of the Affordable Care Act that actually don't generate affordable care, and so those are a concern. So there are many taxes in the bill. Taxes on insurance companies, taxes on medical device manufacturers. Those are going to be passed on to the consumer. That's a concern for me in terms of affordable care. I think if we have a common goal of insuring everyone because everyone should have access to care, which I absolutely believe is the right-minded way of thinking about how to change the system, we wouldn't have things in the bill that raise the cost of health care. So I'd really start there and say, let's put partisan politics aside and let's think about how do we truly achieve more affordable care for as many people in the country as we possibly can. Yeah, it was a decision that we don't make lightly because obviously we have a 70-year history as Florida, Blue Cross Blue Shield of Florida. But we really kept the cross and the shield. So that's our tie to the legacy of the organization. And as we look at where we're going with our company, we're looking at more consumerism, more direct-to-customer interaction. And so Florida Blue was shorter, easier to say. When we field tested it, people saw it as friendlier, less corporate. And that's very important when you're trying to connect at an individual level. Yeah, I think healthcare disparities is a very real issue. And I'll give you some of my history with the particular issue. Previously in my career, I served for 9 years in New Jersey at the Horizon Blue Cross plan there. But during my tenure there, I was on the board of an organization called the American Conference on Diversity, 3 years as the chair of that organization. And probably the thing I'm most proud of is that while I was chairing, we launched an initiative to look at healthcare disparities and actually do training in the state of New Jersey for healthcare professionals in this space around the disparities issue. So one of the things we did was we embedded in the medical schools in New Jersey training and education right at the medical school level for opening the minds up to the range of issues that are in the health disparities space. Then we went in and trained nurses at a variety of hospitals around the issues they need to have top of mind when they're thinking about this issue. It gets into some sensitive spaces when you start to talk about health disparities because for years you couldn't gather ethnicity on the data. It was considered as a bias issue to actually get to that information. Now I think the dialogue has shifted because folks of various ethnic minority groups understand a bit more that gathering that information allows us to understand the disparity in a more clear way so it can be addressed. And I think rightfully so, people were sensitive to the issue. Would it be used against me if ethnicity was being gathered with the health condition that was being looked at? I think it really can be turned the other way. And so what we did was we reached out to churches. We reached out to various groups that were the voice, if you will, of ethnic communities to say, this can actually be used as an advantage. This can actually be used as an opportunity to help focus on issues so there would be more research there would be clear outcomes, and we can make the case for how to address those disparities going forward. In the state of Florida, going forward, there will be health sector jobs that will absolutely continue to grow. Why? Largely, we have an aging population. If we look at demographics in Florida over the balance of the decade, our senior population is anticipated to grow by 90%. We're talking about the aging of the baby boomers. We're talking about continued migration into Florida of seniors. And so we expect that the healthcare sector in our state will continue to grow significantly. I realize as the CEO of an organization, the things you pay attention to and the things you address send loud messages, not only in your organization, but outside your organization. I wanted to be very clear that I believe that I was the point person for diversity in our company, but that I wanted everyone in our leadership team to own diversity. And throughout our organization, everybody to take a stake in our role in diversity within our company and how we engage the community outside. We had very, very good people in a unit that we called the diversity unit. My concern was that it's too easy for an organization to turf to a functional group the responsibility for diversity. And so some people initially thought, are we sending a message that we're backing off from diversity? In fact, now that it has been absorbed by the organization, people realize we're more committed than ever. And this is really a critical part of how we as a management team work. So the folks that are facilitating from our central group that work on diversity come to my executive management team meetings on a regular basis, and they bring forward to us the critical diversity issues in the organization. And those things run the gamut. So we've done things like we eliminated executive parking so that we park with everybody else. We looked at how we address our holidays in our organization. And some felt like there was a bias because there were some religious holidays of particular religions that were acknowledged in our holiday schedule. So next year we'll actually take that holiday schedule and make it a floating holiday so people can use it when it's a holiday that matters most to them. So we've really tried to address some of the things that have sent unintended messages over the years so that people understand the environment we're trying to create inside our organization. We are very committed to all kinds of organizations across the state, and we continue to express that either through contributions, our folks being involved in those activities. We'll be granting some hours off to all of our employees, paid time, so that people can be engaged in more community activities. So we have a lot of volunteer hours right now, more than 20,000 hours given last year alone. We'll probably expand that as we go forward because that's a very critical part of a mission-based organization to be engaged throughout the communities that we serve. So I've tried to take my part in this by walking the talk and being very much involved. So from Miami, where I was there on Thanksgiving week and worked with Pat Riley and Eric Spolstra and Alonzo Mourning, serving on the Thanksgiving line at the Miami Rescue Mission, to being part of the Black Expo in Jacksonville, to sponsoring the Florida Classic in Orlando, to being part of a variety of activities that happen all over the state, from the Feeding America program in Tampa. We've been very visible about the things that we're being involved in to really reach out to the community. And so for me, it's not really about a program, it's about results. It's about taking actions that produce outcomes. And so I think the shift in our organization has actually empowered people to really know that they can make a difference. Yeah, the kind of relationships that we were building in Minnesota are the kind of relationships I'm working on building in Florida, to be candid. It really was taking a collaborative model and saying that the stakeholders in healthcare needed to come together. They needed to see their common focus being the patient or the member, and that we needed to work with each other to do what we do best and do it together. And that's really a different way of thinking, because historically, hospitals have stayed in their silo, doctors have stayed in their silo, insurance companies have stayed in their silo. Each of those entities have lobbied legislatures to slant things in their direction one way or another. Actually spent a lot of time with people from the delivery system at the legislature, bringing a common platform forward in terms of some of the legislative actions that could be taken. Inside of our relationship with the hospitals, we wanted to move from annual negotiation being the basis of the relationship to longer term, let's focus on how do we get quality outcomes. Let's focus on how do we create more cost-effective care in the system. So if you think about how do we incent a system, I'll give you a couple of examples. Instead of just saying to a hospital, you get X dollars more year after year, we said, let's take the guaranteed increase down, but you can earn better than that by producing quality results, and we can share back to you based on savings that you produce in the system. So what does that do to change the way the care model works? We actually said to hospitals, if you can take the BMI, so the measure of somebody's health and wellness status, if you can improve that, we'll share a bonus back to you. So it takes the provider of care from just working on the back end when somebody is sick to thinking about how do I keep my population well in the first place. Smoking rate, if you can take that down among the population that you serve, you get a bonus for that. And so thinking differently about how the provider of care engages the patient. Most of how doctors and hospitals have been compensated in our country has been around the volume of work they do. So the more you do, the more you get paid. And it's always on the delivery of care to people who are ill. We want to take the system and have the system think about how do we keep people well in the first place? How do we take providers of care and have them think about engaging their patients? So we actually paid for things like online consult with patients. So it doesn't have to happen in the office. It can be an outreach to the patient to keep them well, to keep them in a place where they don't need to come to the office, where they don't need to go to the hospital because they're well and they're well in a home setting. So it really does change the paradigm of how the system thinks about the delivery of care. I think there's a world of opportunities in that space. Well, you know, it's interesting, but if you look at innovation across any space, beyond healthcare, how many times have we said, oh my goodness, why didn't I think of that? Because it really is just changing the way people look at things. So if you think about a senior citizen, should we wait until they have a fall and come into a hospital and have a traumatic event? Or should we, as a system, be sending someone to their home to work with them to say, you know, these things in your home space are fall hazards. If we change the fall hazards in the place that you live, the chance that you fall goes down dramatically. You don't have the fall. You don't incur the expense. Everybody wins. It's better for the patient. It's better for the system. It's better for the country. So it really is taking our paradigm and shifting it and thinking about how do we do more prevention? Because prevention is what will deliver much better results for everybody involved. So the two greatest influences on my life absolutely are my mother and my father. They have been absolutely inspirational people. I realized how privileged I am to have the mother and father that I have. They really have been tremendous influences on my life. My mother went to work in the 50s, was an executive with Metropolitan Life, with men working in her unit. My dad was an attorney for IBM, so you think, here's somebody who's going to have a certain view on the world. This is somebody who, in his retirement years in particular, was helping people move into first housing, was bringing diapers to moms who couldn't afford to buy them. He was working in Trenton, New Jersey, in some very tough neighborhoods. They were doing this together for very many years. I had two role models that were groundbreaking in a lot of different areas, and those examples are things that I've carried all my life.